Hi guys, welcome back to my channel. In this video, I'm gonna explain to you one thing that I learned in nursing school that about communication. I mean, like talking to a colleague, right, or a coworker, or a preceptor in nursing, or during your clinicals. I mean, so it's kind of fun to know that there's a concept of elevator speech that it's like talking to you. Someone like feeling that you're gonna be inside the elevator and you only have like limited time to actually introduce yourself, make an impression, and that the other person would be able to understand like a brief things about you, right? So in an elevator speech, usually like what would you say to a person within like 2 minutes? So it's fun because we had the activity. I remember last year, like what would you tell that person, right? So usually you can introduce your name, of course, who you are, and after that, for us, because like I'm in nursing school, you're gonna also explain like why you chose to be a nurse, like why pursue nursing, right? So, hey, I wanna be a nurse because I wanna help people, right? Like sick people get better, and then after that, you're gonna explain also like what skills do you have that you can actually help the nurse, because like in nursing school during clinicals you're gonna be following a nurse, like assisting them while at the same time learning from them too, because like you observe some stuff but you can actually do other like some things that are you're qualified to actually perform, such as like I would say as a student I was trained to actually perform vital signs like taking blood pressure, temperature, uh, pulse pulse ox and stuff like that. So whatever skills you actually know how to do, then you can actually like sell it to the other nurse that hey, I can help you doing this one. And then also what are you trying to do in that clinical setting? Like what's your goal, right? So your goal is to be able to witness something or being able to perform a task that you haven't done before, that you probably did conceptually or in the practice setting but not actually in the real setting. So example like catheter insertion, like you can practice a inserting a Foley catheter on a dummy, but if you haven't done it in person, it's a different scenario, right? Like doing it with an actual person is different. So if you've given a chance to do something in an actual setting, just try doing it. Go for it, right? Because like you also have the person like the nurse to actually back you up in case you need help. So you don't be scared, because at the end of the day or in the future, I mean, once you get licensed and become a nurse, you're gonna have to actually do it yourself too. So uh, learn at the same time, enjoy the experience. So that was the thing that I kind of like realized when I did my clinical last year. uh, yeah, so this clinical, I'm excited because next week we are going to start. I will be starting OBGYNE, OBGYNE. I mean, yeah. So I'm gonna be assigned to hospital, and hopefully the thing that I'm looking forward into is like observing a C-section, cesarean section, because like as you can tell, like I mean, probably people didn't notice that my name is Cesar Ryan, right? Because I was born cesarean, so that's why my name is Cesar Ryan. So it's funny. It's kind of like shallow, whatever. But like I wanna see an actual C-section because again, I know some stuff now that I never knew before. That some pregnant women, they're not gonna be, if they're not physically able to naturally give birth, then they have to do a C-section, which is an emergency. And then sometimes, like it's based on the positioning of the fetus right inside the mother's womb. If they're not head down or they're like transverse, right? So they have to go a C-section. So that will, or other stuff like uh, medical condition like abruptio placenta previa, for example, like that would be a cause of a reason why for the provider to able to perform a C-section. So those are the things that I learned now, like in nursing school, that it's kind of interesting to tie it all up and kind of like now it makes sense now. Before it was just like I'm confused of like, okay, they do it because people did, but now like knowing the specific details is it's fun to know. All right, guys, thank you guys for watching this video. Take care.